The Chinese-born 2019 NCOV that quickly became infamous as novel coronavirus worldwide is caused by a group of viruses that cause respiratory tract illnesses, including common cold, but can be lethal for infants, the elderly, and patients with weak or compromised immune systems. This viral pathogen's previous incarnation was responsible for the 2012 Middle East Respiratory Syndrome in Saudi Arabia and the 2003 severe acute respiratory outbreak in China. Initially, it was thought that coronavirus escalated through human contact with animals because the source of the outbreak was believed to be fishes and live animal markets having bats and snakes in Wuhan. However, Chinese authorities have confirmed that human-to-human contact can act as a transmitter as well. The CDC noted that symptoms may emerge between 2 to 14 days after exposure to the virus. World Health Organization (WHO) has advised travel restrictions on people with flu-like symptoms. The sale of live poultry has been banned in the affected areas. Infrared thermometers have been installed at airports, railway stations, long-distance bus stations, and ferry terminals for the screening of all passengers. The virus had travelled from the city of Wuhan in China to Taiwan, Thailand, Korea, and spread throughout Asia with cases in Singapore, Hong Kong, Sri Lanka, Cambodia, Nepal, Malaysia, and India. Deaths toll from coronavirus has neared the 1500 mark, and suspected cases are more than 50,000. Philippines was the first country to report deaths from the virus outside of the mainland China. The terror of the virus was seen on a mass scale, compelling the supranational body WHO to increase its assessment of the global risk from moderate to high and declare it as pandemic. Hubei province of China has been the worst hit, with the province reporting 15,000 new cases and 240 deaths in just a 24-hour period. To treat infected patients, China has built 2 hospitals at Leinshan and Hoshinshan that can accommodate 2,600 patients. The Ministry of Health and Family Welfare of India confirmed the first case of coronavirus on 30 January 2020, followed by the second one on 2nd February. Total 3 cases have been tested positive in India. The e-visas issued to those in China were revoked and the ones already issued were cancelled temporarily. As per the current numbers by national authority sources, the highest number of suspected cases in India is in Kerala, while suspected cases have been reported in other states including Delhi, Punjab, Haryana, Bihar, Maharashtra, Telangana, Karnataka and Rajasthan. 74 cases emerged on February 14 in Odisha. As of February 14, 2020, no specific treatment options are available for this particular strain of virus. Various researchers are using a genetic code of virus shared by the Chinese government to support the development of vaccines specifically against the 2019 NCOV. Some companies are investigating whether existing antiviral drugs like Tamiflu could be successfully repurposed to treat this novel type of coronavirus. The Norway-based Coalition for Epidemic Preparedness Innovations (CEPI) is one group leading the field. It has funded 3 projects in collaboration with the US National Institutes of Health and National Institutes of Allergy and Infectious Diseases. Thailand, though, seems to have made some headway by seeing positive results after administering a cocktail of antivirals and HIV medication on a Chinese patient. The latest breakthrough seems to be coming from China, where local drug makers are claiming that plasma from cured patients have antibodies that may help other infected patients.